afternoon, everyone. We are here at the final session of the pre-conference symposium of SYMHEALTH 2023, and the topic now is food and mood. The food we consume influences our mood, nutrition, and health. There exists a critical relationship between what you eat and how you feel. As we have more evidence from research on the role of good nutrition for a healthy mind, it is essential to understand the effects of quality of diets, types of diets, and healthy eating for a sound mind. To shed some light on this topic, we have with us Ms. Sayali Dindorkar. I request ma'am to come to the stage. As a seasoned nutritionist and wellness expert, ma'am has held various esteemed positions in the field. She is currently working as a nutrition and wellness consultant at Choice for You. She also served as a chief dietitian and consultant at Lokmanya Hospital in Pune, as well as wellness consultant at Evixis Home Health Solutions in the USA, lecturer at Symbiosis Center for Healthcare in Pune, and clinical dietitian at Sanchati Clinic. We invite you, ma'am, to elaborate on the topic food and mood. Over to you, ma'am.
All right. So here we are at the last session, and I really want you all to be in good mood to listen to this session. So food and mood. So there's one specific, I would like to take you in some other mood right now. So I'll just sing for you. I'm a car singer, but you patiently listen to me. Okay? कुछ खास है जिंदगी में, कुछ बात है जिंदगी में, क्या बात है, क्या खास है, क्या स्वाद है जिंदगी में. What does this remind you? Good. So Cadbury is coming up with the same song and different advertisement. Okay, so let's go to with the sequence that how food and mood influence each other and how they are connected. Okay, so as per researchers suggest that there is a drastic and dramatic change in consumption of food and the acceptance of food over the 10 years, and that is over the globe. Okay, so there's a relationship between food and mood which is intricate, and what we have observed that the selection of the food, what is happening nowadays, it is more influenced with the advertisement, and which has positive and negative effects as well. Okay, let's go to this slide that how mood is connected to our five senses. So what are the five senses? What does it do? Basically, these five senses are the receptor for this body. Right? So when it comes to food, our five senses works drastically, and it keeps the food memory, it keeps the memory the way I sang a song about Cadbury. There is a memory since our childhood that, yes, Cadbury has this song. Okay? So similarly, the color and the bitterness or any of the taste also replicates, related to some ingredient of the food, right? So when it comes to mood and food, can you tell me if there's a birthday, what comes in your mind first? Cake, yeah? So the mood, and it is directly related to our sense of energy. So here, this is before lunch session. If I am, everyone is hungry and everyone wants to get out of here. So when still before this session, if we consider there was a tea break, if I am lack of energy, what will come in mind? What is something which will give you the instant sense of energy? Tea, coffee? Yeah, so this is how it is directly connected. Okay, so primarily, food is much more than what we think. Food is something. Food is just not, when we get into the Institute for Nutrition and Dietetics, we study nutrition, we study nutritional values, we study how to cook for the patients, how to cook normally, how to serve, and how to present the food. But instead, it is completely a sensory expression, experience itself. Because in our food, when we consume the food, our all five senses are involved in this process. So what all five senses? Your taste, your touch, sight, sound, and smell. And what are the basic five tastes? Is sugar, salt, bitterness, sourness, umami, or savory. So let's talk about the taste. Basically, taste is influenced by all our five senses, for all our four senses. But what basic taste sense gives us? It gives us the salt, sugary taste. It gives us the gives us the memory of typical food, which has typical taste, and that could be related to our mother's food, or that could be related to some regional food as well. Second is sight. Sight, which this is something which saves in our sight, which helps to get the perception of certain food. When it comes to orange, what is the perception you received from the orange from nutritional perspective? It is rich in vitamin C, yeah. And what about other, like if you say burger, what is the perception? Junk food, fatty food, yeah. So this is how we receive the knowledge about the food through our senses. Next is our sound. Is there anything relation? How can you hear the sound? Any example? Yes, yes. So, do you know the advertisement again? Karram Kurram? Yeah. So it is related to what? Papad, legit papad. Yeah. So this is the sound what you hear in your mouth. And there is a sound what food creates outside, or what we can hear. Those are like crackling of your mustard seeds or sizzlers. Again, there is a signal passes through all these senses. Then next is your touch. Now touch, we can externally understand the touch, the texture of the food through our fingers, through our hands, and in our mouth, through our tongue, through our palate, through our teeth. Then smell. So basically, smell has, it identifies the odor of the food, but then again, it even identifies the nutritional status, or the what kind of nutrients are available in the specific food. So if we can relate that, again, if we take an example of orange, what happens? What comes in your mind? It is juicy. It has that orangey smell, flavor to it, and it will give you sweet, sour, and fibrous texture, right? So this is how these five senses will give you the perception of the food. Okay, so again, when it comes to, this is all about the perception. When it comes to our body, how this food is going to react, how we are going to, relate it to our body, our gastrointestinal tract, and how our brain is functioning through these senses. Okay, so basically ghrelin and leptin hormone, which I have, these are the basic gastrointestinal regulatory hormones, which are responsible for your hunger and your satiety value. Okay, so ghrelin, it is ghrelin is usually ghrelin is secreted in your stomach. Okay, it is a hormone which secretes a signal to your hypothalamus, and it gives a signal of hunger. So when you feel hungry, you eat the food. And what are the food choices that we need to make? That all depends on the perception of your memory, and even the availability of the food. Then leptin is something which is secreted by your adipose tissues, and it again sends a signal to your hypothalamus that you are full, that it will give the satiety value, and there how you have to stop eating. So this is the functioning which happens through gastrointestinal tract to your brain. Okay, so now this regulatory hormone, I'll just get into a little bit technical part about the ghrelin and leptin. So leptin is a peptide hormone which is secreted by the adipose cells in the proportion of overall body fat what you have. Okay, and it is leptin is secreted in your fat cells to your hypothalamus. It is a messenger who creates a, it creates a signal that now you are full, you have to stop eating. Or in obese people, there could be a different mechanism. It works with about the leptin. And about the ghrelin is produced in the fundus, so the upper circular part of the stomach, and then ghrelin is giving a signal to your hypothalamus at the curved part of your brain. So I have just tried to get the image from Google that will make you understand that how leptin and ghrelin is secreted through hypothalamus, and other hormones which are present in intestine. So what does this leptin and what does this ghrelin do? So leptin basically decreases your food intake, it increases your metabolism, it increases your activity, it also helps to increase the temperature and maintain the homeostasis of your body. Then your ghrelin, it's a growth hormone. It is also involved in many other pathways of your body. So there are few concerns when we talk about ghrelin and leptin. So what are those concerns, and how it is going to take you ahead? So knowing about the role of this hormone, they act crucially in the metabolic pathway of the body, and the human being is so busy in understanding and experiencing the world through our senses that there is hardly attention given to the internal organ, what kind of signals they are giving to your body, and what kind of reaction your body should be taking in, and how you should be pursuing the food. When this perception is there, there are negative and there are positive negative implications, as well as positive effects of this hormone in our body. So ghrelin, leptin, cytokine, and all other peptides and hypothalamus, those who send a signal through hypothalamus, they get disturbed if the things doesn't go well, if you are not consuming your food in proper way, or you are not being conscious towards your food or towards yourself inside the body. So there is a hunger signal, and there is a signal which is saying that stop eating. You have to understand, and you have to make your patient also understand that when the signal is when you are getting the signal of hunger, and when you are getting the signal that you are full now. Okay. If you think about the pathophysiology, I explained how ghrelin and leptin are working, and it really gives the health concern because it is directly related to the lifestyle disorders. Lifestyle disorders are obesity, cardiovascular diseases, hypertension, and many other disease conditions. And if it continued in a similar manner, it can give rise to the chronic disease conditions. Now, this ghrelin and leptin, I will take you a little fast on this slides, because then there is a lot of correlation between food and mood, your gastrointestinal tract, your brain axis, and again, how your senses are reacting. So when it comes to obesity, it has been noticed that leptin is a hormone which is saying stop eating now. The plasma level of leptin is high when in the obese people, and there, it has also been noticed, researchers are saying that the leptin also creates a resistance. The way we have insulin resistance, there is a leptin resistance where the individual will not understand how much to eat or when to stop. And this is a major concern because the signal is not passing. What is happening that leptin is not sending signal to your hypothalamus to stop the meal, to stop eating, and that will create obesity. Now, what is happening that central nervous system and your enteric nervous system, there is a problem between the signaling, the pathway of total gut-brain axis with the vagus vein. So vagus nerve, it helps to send the signal to the brain. And if there is a problem in the availability of the leptin, either there is less leptin in the body or there is problem in the signaling, it can create obesity. And person will not understand why, even if everything is going well, why person is gaining weight. Next is about eating disorder. So eating disorder, I have focused on anorexia nervosa and bulimia. What are the characteristics of anorexia nervosa? Basically anorexia, what are the characteristics? So anorexia, basically, the person who want to reduce weight, who don't feel like eating or try to, or even afraid of eating meals, just because the person will, they are afraid that they will gain weight with particular food. And they act dramatically to reduce the weight, either with lot of exercises or maybe dieting for a long time. So this is when this eating disorder is, when we talk about eating disorder, it is more related to the counseling, psychiatric field, and it is being treated in similar manner till now. But researchers are saying that the people who have this kind of eating disorders, they have high ghrelin secretion in their body. Their plasma levels are very high in ghrelin. So when the patient is coming to you, you need to understand the counseling. So this is all related to your counseling sessions, that how you take your patients, how you understand the report, and how you treat the patient more with the how to understand the food, how to understand yourself, and then how to eat. These are the counseling tips what you need to talk to the patient on this basis, I mean. And there's another, bulimia nervosa. So here, patient will fast for a long time, and then later they will overeat. They will feel hungry, they will not eat, and later they will eat a lot of food that might cross the caloric intake what is required for them that time. They will overeat a lot, and then they will purge. They will try to remove those extra calories in very unhealthy way, might be by puking or might be with the laxatives. So these are this is the way these people behave. And the only reason to keep themselves in normal weight or below normal weight. So even in bulimia nervosa, the plasma levels of fasting plasma levels of ghrelin were shown very high. So when the ghrelin levels are high, that means the patient is hungry. That means patient needs some food. But then just to keep themselves in proper weight, they will avoid eating at particular time, or they will eat unhealthy. I mean, in bulimia nervosa, it has been noticed that they will eat whatever is available in front of them, and then they will have a guilt of it. Okay, so in rheumatoid arthritis, again, it is more related to your obesity as well, because leptin plays a major role in your BMI metabolism, in your bone metabolism, and even in your BMI. And leptin is also observed in the synovial fluid of the joints. So when it comes to rheumatoid arthritis, leptin metabolism or secretion of leptin is very important in some patient. Some researchers says that leptin is high. Some researchers says that there is a resistance to leptin in these patients, which will again lead to obesity. And then there could be, because of the obesity and high weight, bone won't be able to handle the weight, and there could be erosion, and bone density might go down. So yes, mood disorder, yeah. So this ghrelin plays a major role in anxiety, depression, and all this happiness pathways as well. And when it comes to mood disorder, ghrelin levels are um, usually high, and again, because the requirement of energy, the requirement of instant energy kind of thing is very high in mood disorders, where later and it can again lead to obesity, and obesity can lead to depression. So this is how it works. And after administrating leptin hormone, this can be cured, but then you have to go with the natural way with the counseling sessions. It can help the patient to get rid of their mood disorder. Okay, so we went through this negative implications of the ghrelin and leptin. Just to talk more about the positive effects, or the how this ghrelin works. It has a major role in your heart, to control the blood pressure, to increase the output of the, to increase the cardiac output. It also helps in adipogenesis, gluconeogenesis, fat synthesis, and uh, reducing inflammation. So the cycle is very big. It also helps in your insulin modulation in your pancreas, endocrine and exocrine secretions, and it also helps in your reproductive systems as well. Okay, now this is very famous hormone, serotonin. Everyone is aware. So what does this serotonin does? Everyone knows serotonin, right? Yeah. So how does this serotonin works? Okay. So basically, it is a happy hormone. Serotonin is a happy hormone, and it really helps us to get in a mood, get in a different kind of mood. But then, serotonin is produced maximum in your gut. 95% of the serotonin is produced in your gut, and there, when it is produced in your gut, how does it reach to your brain? There is a pathway in your brain which helps this serotonin to reach the brain and react accordingly. So the function of neuron and the production of this neurotransmitter serotonin, it is really highly influenced with the good bacteria. When it comes to good bacteria, gut your gut or gut microbial flora, it really it has to be really good to produce good amount of serotonin in that. So to activate it, it really works well with the, it helps to create a barrier or strong wall between your bad bacteria, between your free radicals, between your any kind of the infection, and it protects your intestine, it protects your gut to get to get into your flora, and it reacts immediately. And basically, it really helps to activate your neural pathway to the brain, to the central nervous system, and to act your body accordingly. So, how does this serotonin is produced? Tryptophan. Tryptophan is an essential amino acid. You get this tryptophan through our protein sources. So what all the protein sources which acts or tryptophan act as a precursor for serotonin hormone. Okay. So when it comes to food, mood, and hormones, and your central nervous system, what is more important? Central nervous system. Everyone knows about the central nervous system, the neurons and the intermotor neurons. Everything is there in central nervous system. But then the other thing which is very important to know is about the enteric nervous system. So this enteric nervous system, it works well, or it has a connection with your brain central nervous system. And enteric nervous system is situated in your gastrointestinal tract. So when and it is spread through the web, like it is through the esophagus to anus. Your central nervous system is spread through GI tract on the wall of your gut. So there is a production of serotonin in your gut, there is a production of dopamine in your gut, there is a production of multiple hormones like ghrelin, leptin, cytokine in your gut, prolactin, ACTH. All these hormones are produced in your gut, and it helps to pass the signal to your brain through gut-brain axis. There are two axes, gut-brain axis and brain-gut axis, where gut-brain axis is very important to pass the signal or about the hunger, about the reaction of the food. Okay, so here you can see that the gut-brain axis, the brain-gut axis, and there is a vagus nerve which helps to connect it completely. And the bacteria who passes, as I mentioned, that serotonin hormone, when it is created, it helps those good bacteria to pass to the brain, and it will help to it will help to give the complete good microbial flora throughout your gastrointestinal tract. And it also helps to regulate your all other good hormones or happy hormones, or which are related to your which are related to your all kind of mood disorders, anxiety, anger, or sadness, or any other disease conditions. So when it comes to communication between your brain and gut and brain, do you know that enteric nervous system itself is it can work independently. It is autonomous nervous system, and your intestine, if it is very healthy, it can immediately take an action for certain conditions. For example, when you have anxiety, have you ever noticed that some people get disturbed, or some people have reaction in their stomach, some people have reaction in their intestine? Either they will have diarrhea, or they will stop eating for a certain period of time. So this reaction, what happens, there is an anxiety, the signal has been passed that there is an anxiety, and your all energy need to be there to face the anxiety. At the same time, your enteric nervous system will pass the signal that now you have to reduce the functioning of GI tract or to increase the functioning of GI tract. And this is how it works. So when it comes to the interaction between your brain and gut, there are many neurons, motor neurons are involved, and the microbial flora or the microbiota is also involved in this communication. So that is the reason you have to be really, focus on your total hormonal health, to understand your mood, So basically, the perception just stop there, and you have to focus on yourself, on your body, how your body is reacting. Okay, so this enteric nervous system responds in, as I mentioned, in different way in depression, and it works in different way in healthy individual. I won't go much in detail with this slide. Okay, let's talk about the functional food, about how your gut-brain axis, how your all five senses, your ghrelin, leptin, and gut-brain axis overall is helping, and how functional food is going to help to control all this mechanism. So this is all a mechanism, and functional food, which is, it doesn't have it doesn't have any definition. Functional food itself says it helps in functioning of the mechanism of the body. There is no definition for this functional food. But other than the ingredients, what we get from, we are more focused on the nutritional values. When the ingredient or the specific food which is giving nutritional values, and more than that, which we called it as functional food. For example, they can, they are good in micronutrients, they have stress reducing effect, they will help to create a serotonin hormone. So these are the ingredient we have categorized into functional food. So functional food, and there's the other category is modified functional food. So modified functional food is something you will see that the fortified oils, the fortified with vitamin A, vitamin D, and fortified biscuits. There is so many fortifications nowadays available, and they are promoting it as a modified conventional food. But the natural conventional food, which has high amount of vitamin C, minerals, antioxidants, and they are heart healthy. Okay, so how does it helps? So it helps in your lipid homeostasis. It helps in your it is very good in antioxidants. So it helps to reduce your free radicals of your body. It protects from your it protects your gut from the free radicals. It reduces the inflammation of your body, which is inflammation due to the external factors, due to certain food, due to junk food. It helps to reduce or cut down or stop there itself, because functional food will help to maintain the gut microbial flora. So when it comes to functional food, your probiotics and prebiotics play a major role, and daily consumption of prebiotic and probiotics has shown a drastic change in mood disorders, in obesity, and the gut microbial flora, and eventually they are getting into healthy, healthy conditions. Okay, so what are the sources? Fruits, all citrus fruits are the sources of conventional food. Cruciferous vegetables are good sources of conventional food. Nuts, seeds, including hemp seeds, are showing very good effect on your mood disorders. Legumes, whole grains, seafood, fermented food, probiotics, beverages, and herbs and spices. Indian herbs and spices has shown really good result in overall your disorders. Okay, these are the modified functional foods. I have mentioned it earlier. Even nowadays you get egg and cereals and all, even millets you get fortified nowadays, if you have observed. Okay, now food that can boost your mood is your caffeine. But all this is shown that caffeine will boost your mood temporarily. There is no performance difference seen when you consume tea or coffee. Chocolate and other sweet, it will improve your mood for a day, but again it is not something which will help to change your hormonal balance, or which will help for all the hormones we talk about. because that is the permanent solution to keep yourself in good mood so that the good hormones will get secreted. Vegetables, fruits, so maximum color you include in your diet, it will help to improve your mood, it will help to give you high antioxidant food. Water and mood. Now, how water and mood is connected. As we have seen, how your GI tract is involved in different kind of hormonal secretion. Water is basically, it helps to secrete or production of your saliva. So it starts from mouth, and it will end in it is even connected to all your all your pathways and even in your organs. So it maintains the body temperature, it helps in the homeostasis, it also helps in the maintaining your total water percentage of the body. It also helps to hold the water through your muscles. So the muscle fat and your muscle fat percentage also makes more difference in your overall pathway. Micronutrients, thiamine, zinc has shown a major benefit and changes and effect on your mood disorders. Yes. Okay, so here are some strategies that how you can help your patients or how you can counsel your patients to enhance their mood with different kind of food. So basically, you need to make them understand that you have to eat and drink consciously. So very first tip about that is that when you feel full, stop there itself. Or the second option is, some people who get burp, they can stop eating at the same time, because burp is a signal that leptin hormone is sending that you have to stop eating here. So next is about when you're thirsty, you need to drink water. Only plain water can help to, we have seen that it will help to improve your metabolism, it will help to improve your mood as well. Then, if you need to add fruit or colors in the diet, ask them to have fresh fruit and colors in their morning meals itself. So ask them to have natural food in their morning meals, either early in the morning or with the breakfast. You can ask them to have some fruit and then accompany that with your Indian breakfast. Later, we have to include all seeds, all nuts, so there should be a good combination of your meal, which should have all these ingredients what we spoke about. So you have to make them understand how they can combine those ingredients. For example, salads, you can ask them to sprinkle some seeds on it. It will help to increase the nutritional value of their diet. So not just nutritional value, but it will add the functional food, and other aspect will also get covered. Again, early dinners really helps in your metabolism. Try to add good amount of soup, vegetable soup, or even non-veg soup, because protein is also directly connected, as we spoke about tryptophan, essential amino acid, it is also directly connected to your mood swings. So, and it will also increase the fluid intake of your body. Again, the requirement of your vegetables from book, what we have learned, and in current scenario has changed a lot. The requirement or the serving size or the portion size, what you should be consuming a day should be around 6 to 7 servings, what we ask our patient to include in their diet, which will help to get good amount of fiber as well as the colors, which will help to reduce the oxidative stress what they are getting. Adding nuts is again one of the helpful option. Milk and dairy products, it will mainly maintain your gut microbial flora. And microbial flora, it is the major, these are the live bacteria in your gut, and your live bacteria plays a major role in the interaction of your gut and central nervous system. I'm almost done. I got a note that my time is up. So I'll just conclude my session with this slide, that you really have to be, what is mindful eating? So basically, you have to make your patient understand, and you have to make your patient tell that you have to be really calm and quiet when you have your food. You have to be present when you eat your meal. You have to be yourself when you eat your meal. And initial or later stage of your consultation, you need to make them understand to how to prepare the shopping list of when you go for your grocery, how to read labels, what is important to understand from the labels, either to buy natural conventional food or fortified conventional food. So making them understand, educating them about the ingredients and how your body is working, it is very important, because as everyone is mentioning, people Google a lot and then they come to us. And when they Google a lot, they have partial information about the food, and there is no information about yourself. I mean, they will not going to understand what their bodies, Google is not going to tell how their body is reacting. So consciousness is very important for person to consume food and select the food choices, what they should be having. Then when it comes to counseling session, make them understand that come to your dining table with a good appetite. There should be gratitude towards food. There should be appreciation towards people who are cooking food for you, even if it is made or somebody from the house is cooking the food. Ask them, this has been told to everyone, that chew properly, chew thoroughly. It will help for the digestion. 32 times practically impossible. Even if you all count that how many bites you are taking for one, how many times you are chewing for a bite, it is hardly 8 to 10, maximum 15. So here, ask them to count that how many times you chew your bite, and that is how, ask them to notice. In earlier days, when we started practicing, we used to ask our patient to maintain a diary. They don't. They will not, or they will fake it a lot. So here, you have to tell them that send us a WhatsApp, keep your notes in your phone, and tell us. Even 3 days recall will be helpful to understand, and recall what you had, that should not be there in recall. How many times you are chewing, what you are choosing, how you go to your dining table, that is all important. And are you in stress? Are you eating in front of television? Are you eating in front of your office laptop? Or are you eating when you are attending a meeting? So there are few takeaway points I will say, that eat when you are hungry, and understand that hunger and your body clock and the time what are assigned to eat lunch, assigned to eat dinner, they doesn't go well with each other. In this scenario, in this sedentary lifestyle and more of a sitting job, and pandemic has really made everyone more sedentary, so the time clock and the body clock has changed a lot. Here you need to counsel your patient that eat when you're hungry, and just try to avoid all the distractions, at least for 10 minutes. It hardly takes 10 minutes to have your meal. And then experience your food and write down the experience, what you're getting through this food. And this is how your psychological status and your nutritional status is going to increase. So this subject is more related to your nutritional psychiatry, and in this psychiatric sessions, food plays a major role, but your counseling session plays a major role, more than a major role, to make the patient change in their dietary management and their addition of healthy nutrients. And that's it. Thank you so much.
Thank you, ma'am, for feeding our minds with such an insightful talk on food and mood. We won't be taking any questions because of the lack of time. I request Dr. Kavita Menon, Professor and Head of Nutrition of Dietetics Program, Symbiosis Institute of Health Sciences, Symbiosis International University, to felicitate ma'am.